China's vice premier is calling for unremitting efforts in the prevention and treatment of HIV/AIDS. Sun Chunlan's comments came as the international community marked World AIDS Day. China's top health authority reported 112,000 new infections from January to October, with over 1 million people living with HIV. Nearly 95% of all infections are sexually transmitted. Transmission through blood transfusions has dropped to nearly zero. Infections through drug use and from mother to child are also down significantly. In an effort to control the spread over the next 5 years, China aims to expand detection and treatment and to promote greater awareness of AIDS. Let's get more insight from Dr. Peter Chin Hong. He's a professor of medicine and infectious disease specialist at the University of California, San Francisco. Give us your thoughts on the status of the fight against HIV/AIDS in China.
Thanks for having me on, Mike. Well, I think that China's made a lot of great progress, specifically in, as you mentioned, not having many or any actually blood transfusion-associated HIV infections in the last 5 years, and substantial progress in the other segments as well. For me personally, some of the biggest impact has been on diagnostics. So having diagnostic tests be more cheaply available for at-risk populations like college students has really been, I think, an advance, particularly in urine and saliva testing. As HIV is still stigmatized, having widely available testing that's cheap and easily done is really going to help stem the tide of infections. So that's in the younger folks. I think there's still some progress to be made in the elderly population, which is increasing in China. Some more attention needs to be paid to that group.
Yeah, I was going to ask you about that in a minute, but let's talk a little bit more about stigma, because we had a story last night that indicated that stigma is still a major issue in China. What can be done about that, and how serious a problem is it?
Well, I think stigma is not only a problem in China, it's a problem all over the world. And in fact, in some countries, people have been hurt, killed, victimized. So one of the big arms towards stigma is really targeting laws. So if we can have laws that protect individuals, that's one way to deal with it. And of course, one of the traditional ways we've dealt with stigma is just by education. And one of the most powerful examples for me personally was seeing some of the sports figures who had HIV, and I think it democratized what these 3 letters mean, which is, again, not a death sentence anymore. It's really a way to get on the right meds and live pretty much a normal lifespan.
Yeah, and I think when you think of stigma, often discrimination comes to mind, as you were indicating. That's obviously got to be a serious problem, too. But I was also looking at a number of sites for research, and I found something fascinating, which you talked about. In 2015, the Chinese Center for Disease Control and Prevention showed that 15% of the new infections were in people 60 years old and over, and I'm wondering what's behind all of that.
Well, there's a feeling that, first of all, from not just China again, this is a global phenomenon, the feeling that older individuals are asexual, they don't have sex lives, or particularly if you're an older individual, you're not considering yourself at risk by engaging in sexual activity, which of course is throughout the whole lifespan. So I think compartmentalizing and stereotyping the elderly population is really ageism, and ageism and HIV is really a bad combination.
Yeah, and I guess, it gets back to education, which is obviously a big component of all of this. So looking ahead, what are some of the biggest challenges in this fight, and is education a major component that still needs to be part of the answer? Yes,
education is definitely continue to deserve a lot of attention. I think that increasing use of technology can help. And actually, there are a lot of parallels between COVID and HIV. And one of the biggest lessons we're still learning it, is that you can't fight this epidemic or pandemic by one's own country. It has to be a global approach. And just like in COVID, until we truly become global in our fight against HIV, we're not going to be very successful. Again, these infections don't know any borders.
Yeah, that's very, very true. Dr. Peter Chin Hong joining us from California. Thanks so much.